Welcome back to PPCM's Painful Truth. Today's special guests, Ashley and her husband, Ron.
Thank you so much for, both your time today in talking about your peripartum cardiomyopathy experience. My husband, and I could speak for the both of us, have, definitely have had our, challenges with this disease, especially having a newborn. How is that? How is that in your life as well? When were you first diagnosed as PPCM? Ash.
I guess, would you say it was December or January?
Probably January. They noticed that there was something up with her heart around Christmas time of 2019. 2020. Pardon me. You're right. Yeah. And then early in 2021 was when we saw the specialist, and that's when they were like, "Yeah, okay, so this is heart failure." And the product of this, by the way, is there. He's kind of confined here right now, but he's adorable.
He's
gonna make some noise in the background.
Yeah, he's a PPCM baby. I love this. I love when, we show the full experience. And can I have? You want to introduce yourself from where you're from or what state?
Yeah. So I'm Ashley. This is my husband Ron, and our son Trey. He's playing with my scrunchie right now. And we're from Ontario, Canada.
Okay, so you are in Canada. Amazing. So yeah, we're here in California. So we're definitely, I see your beautiful snow. We're envious of that. Yeah. Today is a foggy day.
We got a lot of snow the last couple of days.
Yeah, we got, I want to say 50 centimeters. I think translates to about 1.5 feet. Yeah.
Oh, wow. That's fun. My son Liam would be all about it and loving it. So when you were diagnosed, were you diagnosed during your pregnancy, or was it at the point when your life was maybe at a threat?
Yes, both are true.
Yeah, so I was diagnosed in week 36 of my pregnancy. So right near the end of my pregnancy. And I was hospitalized for last week of pregnancy because my ejection fraction was so low. So they needed to closer me, and I had already started. So back in December, like around Christmas time, I had started on a beta blocker just because my EF had dropped down to 40. And then less than a week later, when I went to go see the specialist, they repeated the echo and my heart function had gone down to 30%. So it was moving pretty drastically from what doctors have told me. So for the last week of pregnancy, I was hospitalized, very closely monitored. They started upping the dose of the beta blocker from what they could.
And this was during your pregnancy?
Yeah.
Okay, so that's really amazing. I have heard in Canada that you have the diagnosis kit and instruments. So I'm wondering, do you know, or could you find out if it was the SFLT1 and the PIGF, which is the cardiotoxic fluid with the placental growth blood test, and that's what determined your diagnosis during pregnancy? Because here in America, we don't have that response. I mean, I have interviews all day, and not really one during pregnancy has been diagnosed. They had to have a cardiac arrest or something like that. So you being diagnosed during pregnancy is like is what we're trying to accomplish here in America, which is amazing. I'm wondering, what was the test that they gave you that determined your diagnosis during pregnancy?
During pregnancy, so initially it was the echo. And then when they did the blood work, they noticed the cardiotoxin. I forget what they're called. I don't know what they're called. They noticed like the cardiotoxic levels through my blood work.
So to be clear there, I want to give some context here. Like, it wasn't like they ran the test and they found it. Like, there was a lot going on for a long period of time, and they didn't run this for it. Probably, from what Ashley tells me, they could have run it a lot earlier. And, I mean, I remember, so our son Trey was born on January 13th, so he just turned 1. But like, it wasn't until December 25th that they noticed that something was up with her heart. But a few weeks before that, in mid-November, she was in the hospital for a separate reason. She had a rough pregnancy. She had like 4 kidney stones. But while she was there, they did an EKG, and they said, like, something's up here. You should go see your cardiologist, right? And so it was kind of that led to talking to the cardiologist, that led to him taking a look at her ejection fraction, that led to, on December 25th, okay, we think might be something here. Like, but the message even then was like, we're being cautious here. We don't think that there's necessarily anything wrong being cautious. And then it was when we went to see the specialist that we were referred to on January 7th, it's at that point that they ran the blood test. So it wasn't like, it was 6 days before Trey was born is when we found out for sure.
Oh, yeah. Okay. And what blood test was that?
Don't know what it's called. They just said they did all the panels for blood work. So
and what are the, could you maybe look to see exactly what those blood tests are that had you diagnosed at that time? And who was it that diagnosed you? Was it a gynecologist or a cardiologist?
No, cardiologist, heart failure specialist in Toronto.
Okay.
Her name is Dr. Silverside. She specifically specializes in heart failure in pregnancy. So that's what.
So you had.
But to answer your specific question, no, we cannot tell you what specific blood test it was. They ran an entire battery of tests, and they came back to us. Look, you have PPCM.
Yes. So the question that I would like, and I would be very interested in knowing, is that, was the test that had you diagnosed during pregnancy was in fact the blood panel of the SFLT1? It's actually -1, which means genetic, and the PIGF. And together, it's the 2 diagnoses, because really it's a pregnancy-induced complication, whereas the woman is very healthy prior to pregnancy. And it's actually very common that, PPCM happens to a woman. I mean, the statistics is extremely, globally, it's 1 every 3 minutes, but they can't really make that determination in America because we don't have the diagnosis blood kit of these 2 that we're trying to get FDA approved. Or did they diagnose you with the NT-proBNP test? And if they did diagnose you with the NT-proBNP test, what was your number when you were diagnosed, and what is your number now? And the NT-proBNP.
I know what my number is. I know what my number now for that specific blood test. They did do that in the hospital. They didn't tell me what the exact number was in the hospital, but now that I'm almost close to being recovered, it's down to a 13.
Oh, okay. So your NT-pro, well, it didn't matter if it's full or if it's a full BNP, but your number is 13?
Yeah.
Amazing. Okay. So, yeah, I mean, maybe it was that. I'm just curious because you're in Canada. we're in America.
Mhm.
I called the reps to 2 companies that have the diagnosis, and we can't get it in America, but it does exist in Canada. So I'm
Right.
curious if that test is in fact, which was the test that diagnosed you. I just think it's important for, us to have like these conversations. Every interview, it's like, I never know, because, wounds of wisdom or your experience, I believe if one person speaks up about this disease, maybe it can help piece the puzzle. What we do know is that it's very preventable as early as 10 weeks pregnant, and that no mother should ever die from maternal mortality, only if she's untreated, well, never diagnosed, which is our problem in America, and left not to be treated, which is when, I coded in my bed with my baby next to me, and my husband had to pull me on the floor and give me CPR, and I had my times of death called. And I was lucky enough that, he knew how to do CPR and everything. And, it's very traumatizing, for, like you as a man have to watch this happen, the love of your life, that just gave birth, that gave life, that could possibly, die only due to lack of the awareness and the training. And it's, I know that, and I could speak for, my husband, that, it's something that it's an endless, kind of feeling, because it's so real. And when you're, the fact that women have been giving birth since the beginning of time, and we have such knowledge about, blood tests and pregnancy and the heart association, that it never connected, it never came together, and women are still suffering like it's like the 1800s. And I always say this should be an ancient conversation, but we're having it for the first time. And we are a study to this disease, so this doesn't happen to our children's children. This pregnancy movement doesn't just affect the women, it most definitely affects the men. And, it's preventable. So the fact that there's prevention, there's really no excuse, which is why...
I mean, you're preaching to the choir here. Like, I can walk you through everything that I've been through, and Ashley walk you through everything she's been through. But part of our frustration was more that, so Ashley actually has a pre-existing heart condition. It's called mitral valve prolapse. And part of our frustration was just that her cardiologist didn't seem to want to monitor her through pregnancy, right? And like, it just seems like such a lapse in, maybe not judgment, but at least in policy. Like, if you have somebody who has a heart condition who is pregnant, you should be following them a lot more closely.
Yeah.
Right?
Like, I was diagnosed with mitral valve prolapse when I was 16, and for the most part hasn't really affected my life too much. So when I did get pregnant, I told my cardiologist that I was pregnant, because I just assumed that he might have wanted to follow me during pregnancy, and didn't hear anything back from his office. So this was my first pregnancy. And obviously I don't know how things work when you're pregnant, because I've never been through it before.
Yeah, you have nothing
so
to compare
to. So I was just like, okay, like, I guess I don't need to be followed by a cardiologist. All is well with my heart. And then, like Rob said, probably in November of 2020, I had gone into the emergency or labor and delivery because I needed some pain management, because I was going through trying to pass my 4th kidney stone in pregnancy. So they hooked me up to the monitor to do like the stress test for like the baby and stuff like that. And she's like, oh, like your heart rate is really elevated. So I asked her, well, like, what is it sitting at? And she's like, well, you're laying down and it's about 120. And I was like, no, like that's fairly normal for me. Like for most of my life, I've had tachycardia. So I've had a raised heart rate. And she's like, no, something's not sitting right with me. I'm going to send you down to the emergency room to get an EKG. They do. I thought it was going to be a useless test. The ER doctor, he's like, honestly, I don't know why they sent you down here to do an EKG. Like your heart testing looks exactly how it did back in February, so prior to pregnancy. So I was like, okay, like that's fine. Like I knew this was a waste of my time anyways. So then I had mentioned it to my OB that like the labor and delivery nurse had kind of flagged my high heart rate, and they did the EKG and that came back what I thought was normal, because I don't know if it's different in the US, but in Canada, unless you really ask for your results, nobody really gives you like details. So my OB said, no, she's like, maybe just check in with your cardiologist to see if he wants to run any other tests. And I was like, okay. So I thought this was going to be a waste of my time. So I called my cardiologist and they're like, okay, like we'll see when we can get you in. And then they got me in for December 22nd. So a couple of weeks later. And then
this was obviously during COVID.
Yeah, this was during COVID. So again, I'm doing all these appointments by myself.
Going through this with COVID, has that made this a little bit even more challenging or like for you? Yeah. Because because I know that like when I had it, it was back in 2016 was my diagnosis, after my times of death called, obviously. But like, what was basically that for you?
Like going through with the COVID experience, it was very, like going through pregnancy during COVID was already over, like very isolating. Especially because everything I was hearing is when you're pregnant, you're at a higher risk of more severe complications from COVID. So we kept a pretty small circle of like friends and family and stuff like that. And like doctor's appointments, some of them were virtual, some of them were in person. It really depended on. Yeah,
that's what I was wondering. Was most of your appointments, did you need to go in? Like, you usually here we have like, it was like 9 visits for 9 months. I had way more than that, but my insurance cost me like 40 times.
I had way more than that because early on in my pregnancy, I developed cholestasis at pregnancy, which is like liver failure in pregnancy.
Yeah.
So I was seen more often than the average person by my OB, because my family doctor, she's like, I've never seen this before. I need to refer you to an OB, because usually people get diagnosed with that later on in pregnancy, like in third trimester. So I definitely saw my OB more than the average pregnant person.
Like during COVID, did you do like more in-house visit?
Yeah.
Okay.
We had more in-house visits.
Yeah. Okay. So, has your OB ever heard of peripartum cardiomyopathy?
She has. Yeah.
Okay.
Specifically, this OB is an OB for high risk pregnancies.
Yes. So because I did have cholestasis, she was already a high risk OB. Like she does see people who aren't high risk, but majority of her patients are of those who are at higher risk in pregnancy. So she never said the name to me, peripartum cardiomyopathy. She definitely knew about it, but I don't think she knew a whole lot about it.
Sure.
Like she definitely is not an expert in the field for peripartum cardiomyopathy.
Yeah, for her it was like, we ran into this and you already have a cardiologist, let's get you to your cardiologist.
Yeah,
you know, like, I'm not qualified to deal with this, but I think there's something might be up. So let's, let's double check.
She saved your life. I mean, I have OBGYNs that, especially like mine, at Cedars, Sinai in Beverly Hills, every OBGYN that I went there with every symptom under the sun, they had absolutely zero awareness. And actually a woman just died at the hospital November 21st, 2021, which is why I started this platform, because the same hospital, same doctors, they brushed it off, they brush off, and women have, like I said, we've been giving birth for a very long time. Once you have the awareness of peripartum cardiomyopathy and you know the preventions and you know the right blood tests, to not apply them within practice, like you were talking about, policy and practice is very important to apply, especially with something so preventable. And it just takes awareness. And the lack of it, I don't know, here in America is like literally almost less than zero. I have yet to find an OBGYN office in any state that has really awareness. And when I do hear somebody, they say, oh yes, I know that, I know of that. But it's not like, it's not as taken in the way it should be. Like how important that this is and how this affects a family and how, it can be easily detected. So when you're suffering.
Speak to that a little bit, because like throughout the whole process, I don't think that anybody really brushed it off. Right? Like it would have been nice to be followed by a cardiologist through pregnancy. But we did the testing on December 2nd, and on December 24th, on Christmas Eve, he felt the need to call us because it was that much it was that important to him, right? Yeah. So it wasn't like he was like, "Oh, I ran the test, and I'll wait till after Christmas and let you know."
Yeah,
like, it was pretty prompt, and immediately he referred us to a maternal heart specialist at one of the top maternal health places in the country, right?
Yeah.
And then as soon as we got there, like within 2 hours, they were like, okay, we're pretty confident this is what it is, and you're not leaving, like you're staying in the hospital. Like we went to that appointment on January 7th thinking it was more of a formality and we were going to be heading home. Yeah. And they were like, nah, you're not leaving. Like this is more serious than you thought, and we're going to put you in a bed now.
As my parents always said, is a good doctor is a doctor who cares, and a doctor who cares would call at Christmas Eve, and you are very blessed to have, such medical support.
I mean, this is the same guy who didn't feel the need to follow it throughout the whole pregnancy. So, take the good and the bad, but
absolutely.
Like what you were saying though about like doctors brushing it off. I just want to be clear here that wasn't our experience. There's frustration about maybe we could have done the blood test a lot sooner.
Brushing off,
and there's a lack of knowledge. I mean,
talking about
one
the
of the things
follow-ups
we wanted to speak to is I think there's room for improvement in terms of like knowledge about what can be done here, but I feel badly for women who have the experience of being brushed off, but that wasn't us.
Yeah. Well, when I say brushed off, I mean like there needs to be a raising of standard screening labs and testings for all pregnancies. And it doesn't mean that it's being brushed off. It just means that those tests are not standard and mandatory. Whereas you have a wonderful caring doctor, but at the same time, the follow-ups weren't there. That is to me brushed off in a sense where, because the tests were not standard. If the tests were standard, then you would have had it. It would be like, okay, she's diagnosed as PPCM during pregnancy. Every month she gets her BNP. We make sure that it's lowered. You know, if she needs a magnesium drip, if she needs to be, there needs to be more monitoring. And so to me, yeah, it is. But at the same time, he's a nice, wonderful, caring person. But it's, to me, if it's not standard and it's not mandatory, then it's neglect. And I know that you are suffering. I know what it feels like to suffer during pregnancy, and it hurts. You know, it's definitely not fun when it should be joyous. And, you know, there are doctors that are wonderful. My cardiologist out here, she's at the Women's Heart Center. She's a wonderful doctor. And I love that she's collaborating cardiology with gynecology, because that's really what's going to be really going to create real change, you know, with this pregnancy movement. And, you know, I think that moving like it's like moving forward, but you know, it's challenging. Those challenges are like, once you experience PPCM, we do have the follow-ups. And as soon as we're diagnosed, those follow-ups never end. It's for the rest of our lives. And so that's something that, you know, you know, it's like, okay, well, how do you accept that? How do you cope with that? And that's where I feel like I'm most passionate about, because I understand that there are going to be levels of like frustration and like, you know, all of this disease and what comes along with it, you know, autoimmune system deficiencies, you know, the trauma what the body goes through, you know. Are you the one with, you know, basically it's the POT, the POTS, the, what is it? The, what is it?
We'll cut this part out.
Yeah, no, I mean,
Well,
I'm trying to think of the condition that affects the blood flow. You know, where you feel faint. Is that something that you experience?
I definitely feel faint. I've never been diagnosed with anything. Like I've had unexplained faint spells, which are always fun. The latest one, I don't remember walking towards the stairs, but I did, and then I fell down the flight of stairs because I had passed out.
The POTS, the postural, what is it? Tachycardio syndrome. I don't know. New info to me. If you type in POTS in all capitals, it will tell you that it's a condition that affects the blood flow that can develop symptoms, usually like fainting or rapid increase of heartbeat that may be, you know, that may elevate either, if, you know, if you get up too quick, or, you know, do you ever feel
experience that? It's never been diagnosed, but I definitely do experience that. Because I do get a lot of fainting episodes. They're putting in a loop recorder in a couple of weeks.
It's
so
part
that
of
is like
it's
like
an
a Holter
atomic
monitor.
nervous system. It's in the nervous system. Well, it branches off from the nervous system, and it regulates the functions of you know, your heart rate, your blood pressure, and like your body temperature. You know what I'm saying? And it's like kind of like what I think, like, because you mentioned
blood pressure just like suddenly drops. Is that what happens?
It's worth looking into.
Okay. I'll definitely ask my family doctor and my cardiology team to like look into that, because I've never heard of that. Like that very much describes what I experienced, but I've never been diagnosed.
Well, you sound a lot like you would have the same trauma effect, because I had the liver, I had the kidney stone, I had basically what you're talking about. And what I now I'm post 5 years, this has developed where I've noticed things like it says it can sometimes develop during pregnancy or after pregnancy or from a traumatic event. Hello. So it's almost like inevitable that I think that we eventually feel this, which is why it is important to always know your BNP. Because your BNP can find elevation of cancer or any of that. And then that could be like removed and just, cured, but you won't know that unless you have those numbers. So I'm
followed by the heart function clinic. And every time I go in for one of those appointments, which is every couple of months, they check my BNP levels.
Yeah, they say that the symptoms are kind of like anxiety, but as I think I'm saying it wrong, but it's called a tachycardia, tachycardia and palpitations. It says POTS is not caused by anxiety, but it's misdiagnosed as having anxiety or panic disorders, but it's not. They're actually really symptoms, but they're caused by the nervous, like an autoimmune disease, like what we kind of have, because PPCM has components of an autoimmune disease. And so with that, our symptoms are kind of similar. It's kind of like it comes with the category. So, when there's the awareness with that, I was, I now know, like, okay, my magnesium, or like if my hand curls, it's part of that. It didn't do that the first few years, but this is a new thing. But this is something that kind of, you want to watch out for signs so you can balance like your potassium, your magnesium. Because there are ways to balance it, kind of like mental health as well, but he's so cute. I love him. Hi.
You say hi.
Boo-boo. Hi.
Oh, nice.
You want to wait?
Can you wave? Can you wave to our friend?
There we go.
I got a cracker and I'm distracted, and that's what I'm doing now.
Yeah. Well, I feel like, hopefully that, because you have such great, you have more awareness there, I think, in Canada. And I think it comes down to, you don't have health insurance. How does that work for you within pregnancy? Does
Sorry, it cut out for a second. Can you repeat the question?
Sure. Your health insurance, or how, when you're pregnant, how does your insurance work?
So one of the great things about being Canadian is that it's all covered.
Yeah, it's all covered.
There was never any question about whether or not we would go bankrupt or anything like that. Like, being Canadian, our healthcare system has issues. Like, it's not perfect, but at the time, like, I had just graduated from school, and because of COVID had been having trouble finding my first full-time job. I was working in a factory to put food on the table. But there was never any question of like, what will this do to us?
Yeah.
We didn't have to get doctor's appointments. We didn't have to worry about the cost of medication.
Yeah.
It was, from an insurance perspective, we did have some benefits through the factory work, but like those benefits were benefits in terms of like covering prescription medication that wasn't covered by the Canadian healthcare system.
Yeah.
And it really like was quite minimal in terms of cost. So
That's absolutely beautiful. And I love Canada. I mean, I really do. I love I love Canadians. I love that you guys have that, because really America, we don't have a shot because most women are they're dead. They leave them to die, as well as, which is why we have a higher death rate. And insurance costs no less than $500 to $700 a month. And we don't get diagnosed. We don't get care. They charge for women that need defibrillator vests external. It's $5,000 for 3 months, and you can't buy it. You have to rent it. So it's entrapment. And then my bill for when I was pregnant was over $288,000.
Yeah.
Oh,
But
that's crazy.
because I was,
I mean, like the if we had to put a number value on like how much money was spent on care for Ashley, like it's more than either of us have dreamed of making in our lifetime, right? Like
absolutely.
We had four of the best doctors in this field working on her in Toronto. And then in addition to that, we had our family doctor, our OB, the normal cardiologist. Like there's just so many people involved in care.
It's amazing.
I remember when we were actually in the labor and delivery ward, there was like 12 people monitoring.
Yeah. That's amazing. That's wonderful. That's such music to my ears. I mean, like, this is what we hope for in America. I mean, to be honest with you, it's very expensive. Thank goodness I work for the industry. I had motion picture pension and health plan. I had better insurance that money can't buy at the time. And, I didn't pay anything for it. Was $288,000. But, thank God, as my husband married smart, like where I am a Teamster and we didn't have to pay anything, thank goodness. But the average person in America literally is in debt due to insurance, healthcare, and it's really quite scary when you go to the best of the best, but nobody has any awareness, not even the common sense to say you need to be seen by a cardiologist. And so,
and it's not getting better, right? Like 50% of Americans are living paycheck to paycheck right now.
It's really scary.
It's not like there's money there to pay for better insurance programs.
No, it's not. And again, like I said, like I'm one of the lucky ones in America that, I with what I do for a living, I have a nonprofit, but I also own a locations company for movies and television, and I'm in the motion picture industry. So I'm blessed with, excellent insurance. And if I didn't, I'd probably move to Canada. Because that's just amazing.
If you work in the industry, you might get a kick out of this. I just had to go play Gandalf for our son. He's crawling around, so I had to go make sure. I had to go tell him, "You shall not pass."
Funny. So, what do you hope, or what could you tell any viewers that are watching this and are pregnant, and they're kind of at a loss on everything that you remember how you felt. You just knew something was not right. I mean, your body can tell you. What's the best advice that you can give to another woman who is literally experiencing everything that you experience? Because the symptoms are very common.
Definitely to advocate for yourself. And though we do have great doctors here and the healthcare is free, you still have to do a lot of advocating for yourself in order to get the right test done, to get a proper diagnosis, like whether it's PPCM or anything else, like you really have to advocate for yourself.
Yeah, I think there's sometimes a misconception that like doctors and nurses and hospitals are there to like the doctors, and that it's their job to make sure that you're always 100% okay, right? And they do a wonderful job of what they do, but it is still, I think, the patient's responsibility to advocate for themselves, and learning to advocate for yourself, learning to, ask the right questions and make sure that, for us, it's still not perfect, but I feel like one of the things that makes it different, that you are a habitual journaling type of person. It's not a journal specifically, but everything is in your day planner.
Yeah.
Right. And so
I write everything down. Anytime I experience a weird symptom, I'll write it down. I document it in full to make sure that when I go to the doctor, I have something to show them, so they don't think I'm being a hypochondriac or something like that.
Yeah.
Because I know a lot of people, they'll be like, oh, you're just being too extra, or you're being a hypochondriac, when really they know something is wrong.
Yeah. And
Absolutely.
so where I was going with that, advocate for yourself. But if you find yourself in a position where you need to start advocating for yourself, figure out a good way to take notes.
Yeah.
Whether that's
And that's what I did.
On your phone, or a note-taking app or whatever, just make sure you have a way to record what's happening, so that there isn't a piece that gets missed.
Yeah.
Absolutely. And I thank you for that, because that's what I do. And that's why this docu-series is documenting exactly what you're saying and what needs to happen with an individual, as well as, me documenting your experience. I have documentation where I think I was born to be a documentary. I used to make albums when I was a kid and throughout, and I'm a filmmaker, and I'm very good at documentation. Thank goodness. And by accident, my husband documented when I was actually seizing, and I was having my seizure, and the baby was next to me, and the video turned on, the camera turned on, and you hear his voice, and the how traumatizing it was for him to, try to save me. And
I got to do this.
and then you hear, I actually had my doctor recently. It's the first time in 5 years that I let her see that. And I kind of kept that, every documentation that I have photos, I have videos, I have proof of everything. So when my doctors were telling me I was perfectly healthy during pregnancy, and even after with documentation, they still, best hospital in Beverly Hills, they still just, it was just inappropriate, definitely not practice and policy, and practice. And there was a real need for knowing that documentation is the most important advocacy that you can have for yourself, as well as women all over the world, you in Canada, us documenting, this in particular series is huge, because, we're on the other side of the world, but we still, you and I, you could not even really speak to me about it, and I would know exactly what you mean. You know what I'm saying? Because I physically was there. I know I know the layers of just from physical to mental to, all in between. And it's all the challenges. There's not many people, I think, that can relate to what a maternal mortality feels like. And, before, during, and especially now after, and seeing, the beautiful babies that have been made, and, and how this information is so important and informative that can save another family. You know, it's 2022 already.
Yeah.
So we as survivors, and you know, this doesn't just come from the woman, it's the man as well. I mean, I said to my husband today, you know, I said, you know, I didn't just create PPCM, we created it. Like, it took the two of us to create it. But there's studies that are going to come out, and I'll share them with you, that it's you know, could be it's the way that the growth, the placenta, and how the placenta grows. So it's really it's made by both. You know, it's a 3-deal package. You know, it was made by all, you know, my son, my husband, and me, just like you two and your son. I mean, it's like, to create, you know, PPCM is common. It's not rare. It's just rare for anyone to have really the awareness, because even that you said that your OB, she is a high risk doctor. She was aware, but if she was aware, then she would know that there's really, you in Canada do have the diagnosis kits available. I don't think that the tests are standard. Like you said, it should have been detected a lot sooner. And if it was a standard blood test at even as early as 10 weeks, it would have come up. And if she was aware of the preventions and of the blood test, then why weren't they applied until it was, I'm really having to document what I'm going through, you know? And I think a lot of women, as you said, feel what you felt about how, you know, we don't want to be looked at as like, you know, a hypochondriac and everything. And, you know, I mean, it's so common that all women say that. They don't want to be a bother, or they don't want to be looked at as a hypochondriac, or, you know, and really that's a shame, because that's kind of like it's too many women say that, where we should feel like, you know, if we don't feel well and we feel a certain way, especially to an OB, you know, there should be a little bit more respect, I think, for a woman. That not saying that our voices are, you know, like we're too drama or too neurotic or too this or that. I mean, and even if we were, like, that's when you just take out the blood tests and you just test it and you figure it out. And if this blood test isn't right, you try another blood test. But the fact that you're saying that she did have some knowledge, experience, I wonder why it wasn't applied, because I always think if you have PPCM knowledge whatsoever, it's just careless not to apply it with every pregnancy, knowing that any girl can get it. Any healthy girl during pregnancy can get a pregnancy-induced complication. So I'm curious to why, if she had any awareness, why isn't that standard in her practice? Like, I'm curious. Would you know? No? Hi. Hi. Would you know?
No.
No?
No. I think it's like, it's still like, I don't know about you, but like, obviously there's the PPCM group and I know people on the group, but I don't know anyone in Ontario, Canada who has it. So I'm like, I know there are people are out there because there's a whole practice that my specialized cardiologist runs to help people who are pregnant and have heart failure. But I've never met one in person.
Yes.
So.
Yep. Well, hopefully we do. Hopefully more are aware. And, you know, today I really do appreciate your time and like, you know, telling me, you know, your experience. Is there anything else that you would like to add on like what you went through that maybe can help another, that maybe you say, hey, you know, anything else that you would like to include?
I don't think so. Do you have anything?
I don't think this is maybe relevant to your core audience, but I would tell husbands or partners of women who have PPCM to, if you have access to it, go get some counseling. Like, you will have PTSD. You're gonna watch your partner code in front of you, right? Like it's a traumatic experience.
Yeah.
Like we went through periods in the last year where, you know, at one point, like I was like not comfortable with Ashley driving because we had an episode, right?
Yeah.
And that's not logical, right? that is a classic post-traumatic stress disorder reaction, right? I'm not going to sit here and tell you that it's like 100% better or that it will ever go away, but like, you know, if you have access to people who can talk to you about it and talk through it with you, then go do that. That's not weak to do that.
Yeah, that's excellent advice. I wish there was more of a men's support group. You know, he's smiling at me. You know, what men go through is completely different with PPCM that women go through. And, you know, it's very, I can speak on behalf for John, my husband, that it does require, you know, definitely some support with, you know, he didn't leave my side. He still hasn't. He even got a job. I remember when we were living in West Hollywood, he got a job literally on the corner of our street. So he wouldn't have to go anywhere. He would, at some points, you know, hold a mirror up to my nose to see if I was still breathing. One time I'm like, he's looking at me and I'm sleeping and I'm like, you know, he's just staring at me and I'm like, oh God, you know, we work from home now. We have a locations company and we have a nonprofit, but you know, it changed his life. I mean, for sure. And even still today, you know, I think that there's a lot of struggle. And that's a very good point.
I won't speak for others here, but for me, the experience was you work as and I guess I'm projecting a little bit here, but like you work hard and you do things to provide for your family, and then you find yourself in a situation where you are totally powerless.
Yes.
Right.
Yes.
And the only thing you are allowed to do is watch. Right.
Yeah.
And is I mean, I'm not going to compare my experience to Ashley's experience. I don't really think that there is a need to compare it or compete to see whose experience is worse. But for me, it was like being held hostage. Like I was watching everything happen to my wife and I couldn't do anything about it.
Yeah. And John has verbalized that to me before. And, you know, that, I think that comes along with, for me, and I don't know if this, Ashley, if this is for you, but like there's guilt, you know, there is that feeling of guilt on my side. I know that PPCM wasn't my fault. I know that it's common. I know that it's really unheard of, but for him, I mean, like you said, it's there's no comparison. Both are pain is pain, whether you stub your toe, I say, or you bump your head. Watching a person can be, just as detrimental. I had a father that had dementia. Watching him suffer was just awful. So there's a lot of, I think, guilt that comes for me personally, knowing that what you said is exactly what John has said before. There's nothing that he could have done. He didn't have any control over it. All he could do was watch.
Yeah, I think like what I wanted to say though is not so much that like, well, sorry. And hearing you speak, like one of the things that I know Ashley has also said to me is like, I feel so bad for like having put you through this type of thing. Like, and it's like, this isn't what I describe, what I'm going through. It's not an attempt to make Ashley feel bad because it's not her fault.
Sure.
Right. What I really more was trying
fault.
to get at and wanted to emphasize is that it's important for partners to take care of themselves too. You can't take care of someone if you aren't taking care of yourself.
It is. That's very true. I mean, very well said. And it's true. I think, very much for my husband, John. And I also think that, for me personally as well, I mean, even starting this nonprofit, now I help so many women and children and families, but PPCM took my life, literally. And with that, my mom got walking pneumonia. She died. And then my father died right after her, but they've been in love since they were a teenager. My parents were married for over 55 years, and they had the fairy tale love. They were very, very much in love, and they died with their daughter getting PPCM, and I needed to grieve, cope, get over everything, because it was 4 months after, my defibrillator removal and my heart procedure, that PPCM was just stripping pieces of like my life, my family, and it does, and the guilt that goes behind it, even though you're right. It's even with him, it's not whatever he feels. It's not to make me feel more guilty, but that's just natural because it was my body, and this happened. This was our experience. But at the same time, turning lemon into lemonade, we just move forward into educating ourselves, helping others that are suffering through this disease, and creating, ideas to come together so this catastrophe can be prevented for an entire family. And the support when you go through something like this individually, not just for the woman, I have, families that have, siblings that are like 13, 15 years old. Mother dies after, giving birth to this baby. The baby lives, the mother dies. The siblings are not nice to the one that, because then it's like, you killed my mom. There's always that you want to blame someone. I mean, children need to be also go into some sort of therapy help, especially like this little teenage girl, she's not little, she's petite, but she's, 16 years old. And she's got guilt that she, doesn't have her mother and that she took her mother. I mean, the therapy behind each individual behind this disease is just very, very needed. And the advocacy of it is not there. Not like it is
I agree.
here.
No, one of the things we talked about, like I remember Christmas, because we got the call. Even something about there, I remember we talking about, like both of us, we were just suddenly talking about, okay, if I pass on, what do I want our child to know about my family or experience with my family and vice versa,
Mhm.
type of thing. And I think that there's like, I read somewhere an account from somebody who was saying like, yeah, I feel guilty because I killed my mom. I think in their case, it wasn't PPCM. It was like their mom had cancer and had to stop treatment in order to give birth, type of thing, and then ended up dying. But like the emotions are the same, and I think like the best response, I guess, or what this person of conclusion they came to, really just like, as, and I can't claim that I understand because I'm not a mother, but like as a mother, like you make choices, you make sacrifices to give your kid a better life. There's a part of that I can understand as a father, but what this person, the conclusion they came to is just like that their mother chose to give them life rather than take their life, right? And what they were saying is just basically like, at least at the end, my mom had that agency where she was able to choose who choose to give me a chance, as opposed to not have that ability.
Mm-hmm.
And I remember Ashley saying to me, like, going into the hospital, I don't want to have to choose. And Ashley's like, if you have to choose the baby. And
Yeah, I had the same conversation.
Still sucks thinking about that conversation more than a year later. But I don't think, I look at her now, I can't imagine blaming him for anything, right? Like, no.
Yeah. I remember that conversation too. I mean, it's not a conversation that we want to have. And that's what this painful truth is about, because that's what happens when you're experiencing like maternal mortality. This is part of that, and the survival of the mental reality of what really happened. And I mean, it's one of these things where even for me, I don't want to call myself a control freak, but I do like to get everything done. You know what I'm saying? And so when I don't have control over even my own body, let alone coming from, the man's watching and not able, I mean, there's a whole bunch of like frustration with that. And those conversations are very important. We were even talking the other day, like, I should have a life insurance policy. If my heart stops the other day, I almost passed out. My medicine was changed and my blood pressure went down, and I was doing the dishes and I literally saw myself almost like falling on the floor. And it was for 2 days. I felt like I was floating. I wasn't walking. I was floating. I'm not taking that medication anymore. And now I'm much better. But I said to him, I got to put my affairs in order, and that's, scary to talk about. It's
definitely not something that people think about when they think about having a baby.
Right. Like my baby's only like, I still think of him as my baby. He's 5. He's just so cute. I mean, even the way he the way he talks is just like, he's like so whittle, he's like a whittle guy. He talks like that. He's just and he's so cute. And it's like, I want to be here for all of it. I want to be here for my grandkids, which we can, because we can fully recover. I mean, I went from a 10% EF to my EF been stable in 64%. And that was because I got in the water and I did water aerobics with 90-year-old women. And
I love that.
I
love that.
Yeah, I had my foam weights. I never knew. They all had their phone
Hey,
weights.
I do need to cut in here. We are going a little bit over time here, and we set up in our kitchen here, and we're kind of interrupting other people.
Okay.
Is it possible that if you want to have a longer conversation, we could schedule another time?
Yeah, let's do that. I have a feeling that there's more to talk about when I would love to know what was the blood test that was one that diagnosed you.
Okay.
Was it the SFLT1 mixed with the PIGF? Was it the NT-proBNP test? What was the test that diagnosed you as peripartum cardiomyopathy during pregnancy? Because that's something that doesn't normally happen here in America. And that's something that I think that we can definitely pick up on and just like, follow up and how how everything is progressing with your recovery. It's a year, your heart anniversary. So yeah, we'll definitely pick up where we left off and to be continued. Thank you so much, you guys. You're amazing. You're a beautiful family, and I'm so grateful that you were able to give me your time today and learn from you guys as well.
No problem. We'll talk again soon.
Thank you.
Right,
Bye.
Bye-bye.
Thank you for joining us and listening to the PPCM Fund podcast. If you haven't already, please like and subscribe. PPCM's Painful Truth is made possible through the generous support of donors like you. Help us spread the awareness by donating at ppcmfund.com or click the link below to become a member through Ko-fi. Also, remember to join us every Monday and Friday for Mom Day Fitness. Have a great day.